Hi everyone. Let's go ahead and finish off this section 3 of chapter 22. And remember, we've been looking at the innate immunity this entire time for this section. We talked about the first line of defense, which is those physical barriers that we are going to have. And then we were focusing on these non-specific internal defenses. The last video was focusing on cells and antimicrobial proteins. And in this one, we're going to be taking a look at the other physiological processes that we have that are going to work to help make sure that either it's going to kill off the pathogens or it's going to prevent the spread. So let's go ahead and take a look at inflammation first. So inflammation is going to be the immediate response to ward off unwanted substances. So we'll kind of go through what happens with acute inflammation, and then we'll talk a little bit more about chronic inflammation. So remember, this is a local non-specific response, and this is going to happen with any kind of tissue injury, whether it is a cut that happens, whether it is because you twisted your knee or anything like that, whenever tissue is going to be injured, sunburn, all of that stuff. So those are a few examples. So what you're going to want to do is watch the other video, the animation that goes through these stages, these first couple of stages of inflammation. It's going through and talking about the next few slides. The first step, it's talking about the chemotaxic factors, what the cells are releasing, and then it talks about these vascular changes that occur that are going to cause the different cardinal signs of inflammation. And then we'll talk about what happens when those immune systems get to that area. So you might want to go ahead and pause this video, watch that animation, and then we will we'll get back and finish it up and talk about what's going on here at the very end. All right, so hopefully you watched the animation that goes through the specific events that occurs through inflammation. I know the video didn't really quite go into this delivery of plasma proteins. It talks about it here, about bringing in immunoglobulins, complement, clotting proteins, kinins. So this is going to be really important to kind of start repairing that injury. There's the clotting proteins that are going to come in and cause the clots to wall off the microbes. But what I'm going to do is kind of pick up right here and talking about what happens after, or not necessarily after, but what happens during this whole process later on and why it's happening. So as fluid is moving out of the blood vessels and kind of going into this tissue that's causing the whole local edema, the swelling, what that's doing is it's causing this increase of fluid pressure in the tissue. So that increase of fluid pressure is really important because it actually helps move the fluid into the lymph. Remember, to get fluid into the lymph, we need to have a pressure gradient. So this really big pressure gradient is going to kind of move a lot more of the fluid into the lymph. And with that fluid, it's going to push, hopefully, any other pathogens that might not have been eaten up, or little remnants of pathogens as well. Another thing that it'll push in are maybe dendritic cells that have gone in and eaten up some of the pathogens as well. They are going to be pushed into this lymph. And eventually it brings it to lymph nodes, and that's another way that pathogens can be eliminated as well. So that fluid that's formed is called exudate. And I mentioned this whenever we talked about pus and abscesses. So that's how exudate is actually formed, is through this kind of this fluid that builds up in here, and the dead pathogens and the dead white blood cells and all cellular debris and things like that. So what happens is that within 3 days, inflammatory response is going to slow down, and then this is when the macrophages are going to kind of come in and clean up the area. And then that's also whenever we're going to start to have some new tissue repair. So new tissue / tissue repair that's going to occur to go in and, of course, patch up that little wound that we are going to have. So inflammation is really important for three main reasons. Number one is going in and destroying this pathogen that if it is a cut or anything like that, then a pathogen that could come in, the inflammatory response is going to make sure that it kills it through that cellular phase. Remember, it's talking about neutrophils that are going to come in and eat away. So that's one big thing, is destroying the agent, the infectious agent that might have caused the injury or is coming in with the injury. But it's also going to help limit the spread of the pathogen as well. And then, of course, this is another big thing of inflammation, is this whole process of repairing and replacing the tissue. So it talks about the 4, sometimes 5 cardinal signs of inflammation. And this sometimes, some books will say it's just sometimes it's loss of function. But you had that redness because of all of that vasodilation, that increased blood flow. You have heat, again, because of that increased blood flow and because of the increase in metabolic activity. You have the swelling because of the capillary permeability that's pushing fluid out of the capillaries and into the interstitial space. So this acute inflammatory response typically lasts about 8 to 10 days. And if it lasts any longer, if it persists after this, then it is going to cause chronic inflammation. We'll get to chronic inflammation in a second. Let's talk about why they tell you to put ice on any kind of areas that you might have acute inflammation. Mainly what's happening is it causes vasoconstriction. So anytime that cold is being put on a vascular region, it is going to cause vasoconstriction. Vasoconstriction decreases inflammation because, remember, the video talked about how one of the big things that happens with inflammation is vasodilation. That is going to be a huge inflammatory response. So causing vasoconstriction is going to decrease that inflammatory response. Another thing that ice does is it numbs the area, so it kind of numbs those nerve endings and it doesn't make it as painful as it usually is. So let's take a look at chronic inflammation. This is going to be inflammation continuing for longer than 2 weeks. And the issues that you have here with chronic inflammation is that you have all of the discomfort that comes with inflammation, but it's not going in and ridding the body of any kind of foreign substance. So that's the big issue you have. The key players as far as cellular players is going to be macrophages and lymphocytes, but not neutrophils, because if you think about with chronic inflammation, what you have with chronic inflammation, it's usually because of overuse, like tennis elbow or anything like that. Or it becomes chronic after an acute inflammation trying to eliminate pathogens, like with tuberculosis or allergens, or it could be because of an autoimmune disorder like rheumatoid arthritis. So if you think about that, neutrophils are mainly there for bacteria, so you don't really have a lot of bacteria coming in with overuse of injuries or autoimmune disorders. So that's why you don't typically have a whole lot of neutrophils with chronic inflammation. And the issue with this is that it can lead to tissue destruction or scar tissue formation. And really, depending on the type of chronic inflammation you have, is going to kind of lend itself to the treatment that you might have. It really depends on with what autoimmune disorder it is. With overuse of injuries, they sometimes tell you to take non-steroidal anti-inflammatories. If you have acute inflammation that has become chronic because of allergens, you might be given some kind of steroids to help reduce that inflammation. It really just depends. So let's finish off by talking about what fever is. Fever, or pyrexia, that's another term for it, the fancy science word for it, right? Is any kind of abnormal elevation of body temperature that is at least 1 degree from normal. The reason why this occurs is because of an interleukin. This IL that you see is interleukin. Interleukin 1 or interleukin 6. So these are going to be the type of pyrogen. So let's take a look at this word pyrogen. Again, pyrogen is a type of cytokine, a chemical messenger. Pyro, if you remember, if you know what it refers to fire, and this is going to have to do with endogenous, so it literally translates to a fire within. So these pyrogens can be released from bacteria, any kind of infectious agent, or immune cells can release them as well. So whenever these cells release these chemical modulators, these chemical molecules, they are going to go straight to the hypothalamus. And what happens is the hypothalamus releases prostaglandins, and what that does is it actually goes in and changes the thermostat of your body. Because remember, the hypothalamus is the thermostat of your body. And the hypothalamus is going to go in and raise body temperature. And that is what leads to a fever. So let's go through what onset, stadium, and defervescence is. Onset is going to be when the actual fever is beginning to arise. So there's a couple of things that is going to cause the temperature to rise. Stimulating dermis blood vessels to vasoconstrict. If you vasoconstrict blood vessels, what you are doing, especially here in the dermis, is you are going in and preventing heat loss. So instead of the heat being released from your body, it's being kept inside your body, and that is going to be one way that temperature rises. But another thing is it can target muscles to start shivering, and when that happens, that is going to be an increase in heat production as well. So sometimes chills is going to occur along with all of this. So what it's doing is it's going in and causing that temperature to rise. Stadium is going to be where once you get that temperature up to where the hypothalamus wants it, it is going to be maintained. And this is important because of the fact that this is when it is working to try and get rid of the pathogen. It does it in a couple of ways. It will go in and sequester zinc and iron in the liver and spleen, and that is going to slow microbial reproduction because a lot of microbes require zinc and iron for reproduction to occur. So if you kind of keep them in the liver and the spleen and don't give them to the microbes, then that's going to prevent them from reproducing. Another thing that keeping that temperature elevated is going to help increase metabolic rate, and we'll talk about how this is going to increase the activity of a lot of different cells in our body. So we'll look at that here in a second. Defervescence is going to come in at the very end, and that's when our temperature is going to start to return back to its normal body temperature, right around 98.6 degrees Celsius or 37 degrees. Flip those around, right? Right around 37 degrees Celsius, 98.6 degrees Fahrenheit. So what it is the pyrogens are gone. They're not stimulating the hypothalamus anymore. And the hypothalamus is going to stimulate mechanisms to get rid of the heat now. So it is going to cause vasodilation so we can get the heat out through, of course, the dermis. It's going to cause us to sweat. That's also another way that we get rid of heat, right? Think about what happens whenever we're exercising. That's why sometimes you can appear flush whenever towards the end of the fever, whenever it's coming down, because of that vasodilation. It's really important to make sure that when you do have a fever to increase your fluid intake, because if you think about how in this stage you're going to start losing water, you want to make sure that you replace that water. It's very important. So here's the benefits of the fever. Again, we talked about how sequestering that zinc and iron is going to make sure that those bacteria or viruses don't reproduce. And a lot of the rest of this has to do with increasing metabolic activity. That's going to help promote interferon activity. Remember, interferons, one of the interferons we talked about prevents viruses from reproducing. Look, it also increases activities of the adaptive immunity. So we'll talk about how it goes in and increases those T cells and B cells, gets them to work quicker. It helps repair tissue. And another thing that it does is it increases these CAMs on the endothelium. And what that does, let's go back and show you where that came from. It came from inflammation. Here are the CAMs. The CAMs are going to be these molecules that are going to be found on the inside of the endothelium of the blood vessels that help the white blood cells kind of stick onto the blood vessel, and then they're able to squeeze out of the holes. Get back to where we were. So that is going to kind of make sure that more immune cells are migrating out of the blood and getting to where they need to go. So a lot of doctors will tell you not to treat a low-grade fever. Let the benefits of this low-grade fever take its place. Let it go through this process. There's a reason why there's a fever going on in your body, so let the body do its job. However, you've got to make sure that you're constantly monitoring that fever, because if it gets too high, like for 103 in children, that is a high fever, and it's going to be a little bit lower in slightly lower in adults. So what happens is it gets to that point to where proteins start to denature. And if you have proteins denaturing, then they are not doing their function that they're supposed to do. It also changes metabolic pathways. Seizures can occur. So look at that. You have irreversible brain damage, anything greater than 106, and death is likely over 109. So here is that nice little, we looked at this picture of the cute little baby looking at all those first lines of defenses, and this is what we just covered here in the last couple of videos, looking at the second line of defense and everything that is occurring. So what we're going to be looking at for pretty almost the rest of the chapter is the adaptive immunity. So the next section is going in and just introducing it, looking at some key cells, looking at some key structures of the adaptive immunity, and then we'll go on to specifically look at how T cells and B cells work. So remember that this innate immunity is great to prevent any microbes from spreading or destroying the microbes immediately. And if it does spread, or it also goes in and kind of slows the reproduction to help with the adaptive immunity to kind of kick in. So we'll talk about how the adaptive immunity takes about a week or two for it to come in full force. So that's a really good thing about having this innate immunity. So until next time.